Hello, my name is Graham Southwick, and this is needle decompression. So, when I approach the patient, I'm assessing for a potential tension pneumothorax. So, what I'm going to be looking for is unequal chest rise, unilateral chest movement. I'm going to look for tracheal deviation. I'm going to auscultate and listen for decreased or absent breath sounds. And I'm going to also look for hypotension and dyspnea. So, after I've assessed, I've seen that the patient has 0 lung sounds from apices to basis on the left or on the right side, in addition to tracheal deviation, and he is hypotensive and dyspneic, respirating at 30 breaths per minute, labored. So, first I'm going to, since this is an emergency procedure, I am not going to give analgesic prior to this. Patient is, for the sake of this assessment, unconscious. First I'm going to landmark where I'm going. So I'm going to the sternal notch, finding the second intercostal space. I'm going to follow that to the mid-clavicular line. I'm going to write with my pen where that is. I'm going to take an alcohol and I'm going to cleanse the site. All right, so I prepared my needle decompressing needle with 2 cc's of normal saline attached to the catheter. All right, so I have my landmark space. I'm going to follow above the 3rd rib, making sure not to go underneath the rib and cause arterial or venous damage. So above the 3rd rib, I'm going to go in a perpendicular form straight down. While I'm pushing down with the needle, I'm going to slowly apply negative pressure. I'm going to look for bubbling. Once I see that bubbling or blood, I'm going to advance the catheter and remove the needle. All right, so I've removed the needle. I'm going to hold this into place. I'm going to look for any changes in chest rise, and I'm not going to apply anything on top of this. I'm going to leave it in place and just maybe tape it down just to know where it's at. Leave it exposed at all times. Reassess the patient. In the event that I was unable to access this part, I'm going to apply, so I'm going to landmark the 4th or 5th intercostal space mid-axilla. So again, 2nd intercostal space, 3rd, 4th, follow that around to the mid-axilla line. I'm going to follow the same procedure, making sure to go on top of the rib, not below it. I can also do this to the 5th intercostal space.